if you had surgery, or you've had a baby, or you've put on a lot of weight, or quite quickly, you might find that what you have is a split in your stomach muscles, and that stomach muscle split is called a rectus abdominis diastasis. And basically what it means is, if you think about your normal six-pack muscles, so you've got your normal rectus abdominis muscle, the split means that there's a gap between them, okay? And what that means is that normally the gap is deep and it goes through all the different layers of the tummy muscles. So if you're thinking of your normal stomach muscles, you have your six-pack muscles that you see on top. You then have your external obliques, which sit underneath that, and then you have your internal obliques, which sit the opposite diagonal underneath that, and then underneath those you've got your TA, or your transversus abdominis. Obviously you've got fascia and everything else that goes on top, and then beyond that obviously is your internal organs. So you're looking at sort of 4 layers of muscle, okay? Now if you've had, like I say, you've gained weight quite quickly, or you've had sort of a baby, and the baby is obviously pregnancy has caused you to push out, it has the same effect. You've had a massive weight gain in a short space of time, and what happens is, if you liken this to the 2 bits of your six-pack muscles, what happens is that rapid weight gain causes a burst, and these 2 separate, and you end up with a split in those tummy muscles. So it is basically I tend to liken it to saying that it's like wearing a pair of trousers and then not doing the belt up at the top. You've sort of got your trousers and they're sort of hanging, but they're not staying in place, and they're not able to sit and do the job that they're supposed to, because you've not tightened the belt to hold them everything in place. So that's basically what happens with your abs. Your ab muscles, and we're talking all the 4 different layers here, should sit, and obviously when you've got your rectus abdominis muscle, you've got the very tiny gap. So when you're looking at all the people who are really toned, and you see their skin, their sort of abs, and they've got that little line, and they've got their digitations, basically their six-pack is there. What happens when you have that massive weight gain is that the actual integrity of that linea albus, so that line of fascia, gets broken, and you can have a diastasis, and that diastasis can extend from where the abs are at the top right the way down to the pubic bone. You might find it's just around sort of that belly button area, and that's basically really important, because if you remember from your core is your fascia and your abs, and basically your transversus abdominis muscle from the deepest layer, working with your diaphragm, working with your multifidi and your thoracolumbar fascia, working with your pelvic floor. Now if you've lost the integrity of the front of that cube, or the front of that area, you've not got anything then supporting your spine here, which means that you put more work on the back. If you've not got things that are supporting you here, then you might find you tuck under, and you're using other things like your big hip flexors to do the work instead. So from a realistic point of view, if your core is weak, and what we're looking at is if you do have a rectus abdominis diastasis, or an RAD, or a tummy split, then basically what's happening is you've lost that ability to have that support at the front side. So you are going to have a weak core. It might work, so it might still have some integrity and tone in it, but it's not going to be the way that it should be. But also what comes with a weak core is that we get a weak pelvic floor, and our pelvic floor isn't as efficient as it used to be, which means that that can present as frequency or urgency. So we need to go to the toilet a lot more frequently than we would normally do, or we need to go right now. And those 2 things are very sort of similar and very interchangeable, and it tends to be a training issue where your muscles are weak, and they're probably working too hard, but they're very, very weak, and that's one of the pelvic floor issues. So if you're concerned that if you're on a full bladder, or you had to jump, or you had to cough, or you had to sneeze, that you might have a little mishap, then that's a sign of a weak pelvic floor. going on side with the weak pelvic floor, very common if you do have an RAD, so if you do have an abdominal split. And then the other side of that is if your tummy muscles at the front aren't supporting you here, then you're more prone to back pain because the muscles at the back are having to work a lot harder to compensate for these muscles here. You might have tight hip flexors because your hip flexors are having to compensate for weak abdominals as well. So there's a fair few things that can go on with having that tummy split. So if we go back to here, and we go back to your area here, if everything's there and it's now sitting and it's doming around, because obviously it's still attached to the top, it's still attached to the bottom, it's just the two curtains have pulled apart and then need to close again, then we need to check what's going on. So I'm going to show you an easy way to check for your abs. So I'll just move this in a little bit closer so you can see if I'm lying down, hopefully. And then basically what we're looking at is as we're lying down through the abs, we're having a feel of our tummy muscles. And the attachment is right the way at the top at your xiphoid, so just under your rib cage, and it's right the way at the bottom at your pubic bone. And the abs run obviously through here. So what we'd want to do is, if you've got sort of tight pants on, just lower them down and loosen them off a little bit. You want to have a feel in where your abs are, okay? So where your normal line of center would be. So if you go from your tummy belly button, you want to put 2 fingers below it and 2 fingers above it. And then all I'm going to get you to do is have a feel and lift the head up. Okay, so all you want to do is just start with, lift the head up. And what we're feeling for is there a bit of a gap? Do your fingers sink in, okay? Or does your tummy stay taut and you can feel the difference between the two? So you can feel where that normal line of pull would be, okay? If you do have a gap, what will happen is as you're feeling through here, you'll feel the 2 edges. So if I grab my strap, if I'm coming up through here, if I've got a gap in my tummy, as I'm pushing, I'll feel the edges of my belly. So instead of everything staying sort of taut here, I'll be able to feel that there's a gap and I can feel that difference between. So that's what we're after. And if you do have a gap, as you lift your head up, you want to feel, does that gap move apart or does that gap move together? Because ideally, you want that gap to move closer together, okay? So that's what we're feeling for when we're feeling in our abs. Now, you can go lower down, so if you know you've got a gap here, then as you've lifted your head up, just track it down and see how far down does that gap go. And then same, if you can feel it, see how far up does that gap go. So you know the gap is from 2 centimetres or 3 centimetres above your belly button to 2, 3, 4, or it goes right the way down to your pubic bone. And then what we're after is the width. So can I get 2 fingers in that gap? Can I get 4 fingers in that gap? Or is it bigger? So we're looking at where your fingers are. How big do you feel the edges of the tummy? Okay? Now that's obviously the easiest way from our point of view to do it, because we're looking at bellies all the time. So we're looking at people and we're assessing people and we're looking at, what's going on with people all the time. What you're looking at is obviously your sort of tummy and the gap that's there. So what should happen is the gap's wide. We want to see how wide that gap is and we want to see how long that gap is. And the idea is that as you contract those muscles, you want the muscles to be coming together. You don't want the muscles to be pulling apart any further than they are, because we want to be training them to come back together. So that gives you a little bit of a rough idea whether you have something like the diastasis. And it doesn't mean that it's the end of the world if you have a diastasis. There's heaps and heaps of people who do have diastasis. The thing is that if you've also got back pain, or you've also got pelvic floor pain, or you're also struggling and you fatigue very quickly, that's all very common with the diastasis, because what's happening is the tummy's not knitting together at the front, the tummy's not coming together, and it's not controlling together. So if you've had a baby, if you've had like I say, surgery, so you might have had a C-section, or you might have had a laparotomy where they've made an incision down the front of your tummy, you might have had your gallbladder out, something like that. You might find that what happens with that is your tummy muscles go to sleep, your tummy muscles in your core gets weak, but then on top of that, if you've had that compromise in the structures, you might find they also split, or they also just move apart, okay? So it's not just a problem with girls, because we're the ones that tend obviously have babies, but it's also a problem with men, and men can have a tummy split. It tends to be called something slightly different with men, as opposed to erectus diastasis. So what you will find is in the men, they tend to dome. So in men, if you have one, instead of like the tummy feeling that it splits that way, the men tend to have like a little bit of a tent that goes up instead. Management of both is very similar. We want the muscles to be able to contract, you want the muscles to be able to draw back, so you've got that TA doing that support, so you want the deeper muscles to pull back against the spine that way to give you the support. You want your obliques to be working to work that way, and you want your rectus to come together so that everything's pulling in, as opposed to when you activate and everything pulls apart, okay? The other thing that we want is when you're activating that you feel that everything pulls that way, you're not having everything that domes outwards and pushes upwards, which again is very common when you have a little bit too much going on. So if you know that you do have a tummy split, you know that it is a split where you can feel the edges, and you know that basically a rule of thumb is it's less than 2 fingers and you're able to close it and control it. There's not too much to be concerned about. The tummy's controlling it. There's obviously a bit of a gap, but it's not too bad. If it's more than 2 fingers and it's gaping and it's coming bigger, and there's definite edges and it's gapping, then that's when you really need to be aware of when your limits are, and the work needs to be done to actually bring the tummy muscles back together, make sure they're contracting, and make sure that they're pulling back and pulling in and backwards towards your spine, as opposed to pushing out and pulling apart, because then you're putting too much force on them. And this is why when people go back to things like boot camp, and they try and do planks, and they try and do these high level things before you've done all the prep work, this is when backs get worse, or backs get sorer, or you say, look, I'm trying to get fit but it just hurts my back even more. It's because if you do have a split at the front can't control it, the front can't manage to hold everything together, and then you get more pressure at the back, and then that back's getting fatigued, because not only is it trying to do the work of your core, you're also trying to get it to support you, you're also trying to get it to hold you, and then probably also move you as well. So then your back goes, nah, I've had enough. So very important, if you do find that you have a diastasis, that you do have a gap, that you make sure that the gap is closing and the gap is coming backwards, not that it's gapping wider and the muscles are pushing up into your hand, okay? So a little bit on rectus diastasis, so it will be named RAD, rectus abdominis diastasis, or you might hear it commonly called a tummy split in your abs. Like I say, very common if you've had a baby because of pregnancy, very common after C-sections as well, because obviously you've had the incision, but also sometimes they cut along your actual abdominal muscles to be able to get baby out. Common after abdominal surgery, and common after a massive weight gain. Can affect men as well as women, but obviously the men isn't pregnancy related, it's for other reasons. So just be aware that if you are having your tummy, then it's not activating well, and you do have a tummy split, you do need to do the work at the background to make sure that your tummy muscles are effectively working for you. Otherwise you're at risk of getting your pelvic floor even weaker, because you're going to put a downward pressure on your pelvic floor and an upward pressure on your abs, which is going to compromise and leave you more prone to back pain and more prone to pelvic floor issues as well.